Hi everyone, this is Meir and staff at the School for Self-Healing. I feel that many people believe that if something, a medical procedure is being done for everyone, that it's a good procedure and there's nothing wrong about it, and it will keep being done again and again. Let me bring up the fact that so many people have many joint replacements, hip replacements, knee replacements, and others. And there are many reasons why somebody replaces the hip or the knee. People could definitely have genetic tendency for poor cartilage that gets ruined. People could have an autoimmune disease with a good attack on the body, and autoimmune means that the body attacks itself for different reasons. We tend to have inflammation. Also, many people are overweight, but even thin people have rigidity and problems. And we think that what we need is to always fix our situation, always fix it, to comfort. And that's true about the body, that's true about our senses, that's true about every part of us. And while sometimes it's all we can do, we have to fix a big problem. I mean, if you don't replace the hips, you can't walk. I remember the lady who came to me from 3.5 hours away in Auburn, California, east of Sacramento, and her complaint was that she could not anymore lift her right leg up. And she couldn't sleep well because her hip was very painful. She had a wonderful husband, and I taught him to work on her leg. I discovered that her thigh was very, very tight. A muscle that straightened the leg, called quadriceps, was very, very tense. So I loosened up that tension with 7 sessions of mine and diligent work of her husband, who learned the massage techniques for me and loosened the tension in that specific muscle. It's called the rectus femoris, a part of the quadriceps group. Sorry to bore you with those names. But what happened is that within 7 weeks, she could lift her leg up without any problem, and said it's the first time in 2.5 years that she can sleep comfortably because the hip is not hurting her. Just yesterday, I met a wonderful lady who cannot lie on her left hip because it hurts so much. And we didn't get to that achievement. It's only the 2nd session I've seen her. But it's the first time that for a few minutes she could lie on her left hip when I discovered the muscles that are tight. Yes, the surgeon of the First Lady did see that there was no room between the bone of the thigh, called the femur, the head of the femur, and the hip joint, the acetabulum. And so he thought that the natural thing to do is to break that area, clean that area, and put artificial hip joint. But in her case, when you loosen the muscles, the space was created. And I had a case in the 80s of somebody with rheumatoid arthritis who, when she started to work with me, she had rheumatoid arthritis and no space between her bones. And after working with me for a while, it all changed. On the one end, when I took her to a warm pool, after the warm pool she could not move, and people had to bring her to my office to help her to move because the warmth created inflammation. And when she had to face gravity, it was hard for her to be mobile. But After that, we learned that she needs to cool her hip while doing the work in the warm water. And we did a lot of work to expand the space between the bones. And within 6 months, she gave me a call and she said, I have a good Hanukkah present for you. My professor, or my doctor of medicine, who's a professor in UCLA, showed me the x-rays, and a whole centimeter was formed between the bones. You can create those changes. And so here is the thing. The woman that I described right now was advised by orthopedists to have a cane. Well, sometimes I advise it as well. But the first advice I gave her is to mobilize her ankle, to go heel to toe, and then she doesn't put so much pressure on her hip joint. I also worked with her first on her neck and middle back to help the hip joint. All the joints are connected. Not only the injured joint should be attended, and in fact, if you only work on the area that is damaged, you don't stop the process of shrinking. And when you don't stop the process of shrinking, the surgery is good. It allows more movement if all goes well and there are no problems. And that could be the case. There could be problems. But if it's all good, it doesn't stop the process of shrinking. And if you continuously shrink, eventually you need to replace that joint again, and then once more, and then you go to the wheelchair. Now, same thing with vision. If you allow your eyes to become nearsighted, with time, they become so long that the retina can detach. And there could be a solution, reattachment. There are times when it's necessary. But think about it. If to begin with you reduce your nearsightedness with looking at a distance, paying attention to your periphery, things will change for you. If you have stiff neck, with time less blood flows to your brain with many problems, like strokes and others. Think how easier it is to loosen up your neck and there is no stroke. If you start to not hear well, there's some wonderful hearing exercises. As soon as you put the hearing aid, your hearing is diminished, even though your social function improves. So it is when we start a problem. This is the time to resolve it. And I was so happy to speak to somebody from Switzerland today through Skype and help her resolve many problems that she started to resolve herself. That the evolution of her life will be one with no problems. Use your symptoms as your guide. That's why working with my book, Awakening, Your Power of Self-Healing, could be powerful. More powerful than that is to come to my workshop, and even more powerful than that is to come to my initial training, where I train you first of all to take care of yourself and to prevent deterioration in life. So, please listen to my advice. Work right now on your seeing, on your hearing, on your stiffness. Get rid of them now. And don't have situations in life when things get worse and you're subject to surgery and artificial treatment. That's my message. That's what self-healing is about. And that's why I need to train more and more practitioners that can teach the whole world that that's the best prevention there is and the best treatment there is once there is a problem. Many blessings to all of you. Meir.